Welcome to SPC Tutorials. Today we'll be looking at Introduction to Pharmacology. This class is going to be fun, entertaining, and educating because I'm going to be telling you stories to explain many concepts in pharmacology. Now, to begin with, I want to ask you a question. If I'm feeling cough or if I'm coughing and I pick up a white substance that I don't know what the substance is all about, probably a white powder, and I pour it into my mouth, and after some hours the cough stops, I stop coughing. Now, do I say that this powder is a drug or this powder is a medicine? What is drug and what is medicine? 2. Who told this powder to go straight to where the thing that is causing my cough and stop the cough? Why not this powder work for headache? Just go straight and work for cough when I was not the one that instructed the powder on what to do. 2. The third one, what happened to the powder that I took inside the body? Welcome to Introduction to Pharmacology. Now we're going to go straight. First, what is pharmacology? Pharmacology is the study of drugs. Simple word. Pharmacology is gotten from two Greek words, pharmakos and logos. Pharmakos, this means drug. Logos means study. So pharmacology in simple words means the study of drug. Now let's talk about drug. What is a drug? A drug is regarded as any substance which alters the biological function of the body through its chemical action. A substance that alters the biologic function of the body through its chemical action. Please do not forget the word chemical action. So a drug, there must be a chemical action for a drug to alter the biological function of the body, because it's not only drugs that alter the biological function of the body. There are other biological substances in the body, like your hormones, your enzymes, your neurotransmitters, that alters the biological functions of the body. But once you introduce a drug that has a chemical action, we'll call it a drug. Now, what are medicines? Remember, I was talking about the powder. Medicine are drugs with therapeutic effect. Drugs that has a therapeutic effect are regarded as medicine. It's not all drugs that has a therapeutic effect. There are some drugs that you take, it can even make you go crazy, or it can even do something outside rendering you therapeutic help. So not all drugs are medicine, but all medicines are drugs. Now, how do we know the drugs? How about we talk about the drugs that are not medicines? That is when toxicology comes in. Toxicology is the study of the harmful effect of drugs in the body. So toxicology actually has to do with studying those drugs that are actually not medicines, that are not therapeutic. Now, let's go straight to receptors. Okay, back to the question that I asked you. Do we now say that the white powder is a drug or the white powder is a medicine? Understanding the concept of drug and medicine, the white powder can be regarded as a drug and as a medicine because the white powder rendered therapeutic effect. Now, how about the next question that I asked? How did the powder understand that I needed to cure cough? Introduction to receptors. What are receptors? What do we call receptors? Receptors are biological molecules which regulate the body function. Biological molecules in the body. Which regulates body function. Now, understanding what a receptor is, what is now the role of a receptor in pharmacology? Remember that we say that drugs alters the biological functions of the body through chemical actions. Now, first of all, there is a bond between a drug and a receptor. What a drug does in the body is that the drug binds to the particular receptor. Now, when we talk about receptors regulating, that means the receptors are responsible for things in the body. I'm going to use you a very easy example of some things that you are very used to. Your heartbeat, your blood pressure. There's a receptor that is responsible for blood pressure. Now, if my blood pressure is high and I'm giving probably propranolol to reduce my blood pressure, propranolol is a tablet. It functions as an antagonist to your neurotransmitters, epinephrine and norepinephrine. That is gotten from your sympathetic nervous system. We'll call them your sympathetic hormones or neurons are regarded as your flight or fight hormones. Now, what those your epinephrine and norepinephrine does is that they stimulate the heart, the arteries of the heart, leading to increase in blood pressure. Now, what a drug like propranolol is going to do is that it comes and binds to the receptor responsible for releasing epinephrine. We know we're going to talk about drug as an agonist and as an antagonist. So what it does is that it functions as an antagonist, binding with the receptor that is responsible for the release of epinephrine and norepinephrine. So what it does is that it covers it and reduces the production of epinephrine, so the heart's vessels will now be relaxed, into the reduction in your blood pressure. But before then, let's talk about the three bonds that happen between drugs and receptors. Remember, I made you to understand that drugs bind to receptor. There are three bonds. We have bonds. We have covalent. One is covalent. The other one is electrostatic. And the last one, two. And the last one is hydrophobic. These are the three main bonds that occur between drugs and receptors. Your covalent, electrostatic, and hydrophobic. Now, in the order, your covalent is the strongest bond. Your electrostatic is a weaker bond compared to the covalent, while the hydrophobic is the weakest bond compared to all. Now, talking about the bond, now let's go further into talking about drugs as agonists and antagonists. Just like as I was explaining to you, the illustration that I gave to you, that I was having cough and I put in a powder into my system and the powder functions to reduce the effect of the cough. What happened? Now this was what happened. Drug function as an agonist to antagonist. Now agonist means to stimulate, while an antagonist means to inhibit. So it means that drugs either work as an agonist, stimulating the receptor that is responsible for a particular action, a particular biological function, or it works as an antagonist, inhibiting a receptor that is responsible for a particular biological function. Now let's say, go back to the illustration I gave to you. I was coughing. There's a receptor that is responsible for cough, right? Now what the drug that I'm going to take in, the substance I take in did was that it binds to the receptor that is responsible for cough as an antagonist, inhibiting the function of that receptor. So that means that receptor was stimulated. That was why I was coughing. I was reacting to increase in the number of that receptor in my body. So that was why I started coughing. So immediately the drug comes in to inhibit that receptor, the cough comes down gradually. The same thing that happens. Let's say, for example, when someone is fainting as a result of lack of glucose in the body system, you discover that they take you to the clinic and they start infusing electrolytes, like the distilled water, or some they start giving you oral drip. Now that oral drip functions as a drug, but what does it do? The oral drip functions as a drug to stimulate the receptor that is responsible for releasing the blood glucose in your body, and thereby stimulating blood glucose in your body and working as an agonist to blood glucose. So that means there will be increase in blood glucose in your body. So these are the two major ways that drug functions. It functions as an agonist or as an antagonist, nothing more. Remember, it binds to the receptors and functions as an agonist and as an antagonist. Now let's look at the three major functions of the receptors in the body. Let's quickly look at the three major functions of receptors in the body. There are actually three major ways that the receptors function in your body. Now let me ask you a question. If you are given a drug, or as a pharmacist, how do you determine the dose that the patient is going to take for maximum effectiveness? How do you determine the dose? That one is one. Also two, if you're giving a drug for pain, probably a drug for headache, who tells the drug that he should go and bind to the receptor that is responsible for headache? Now let's look into these major functions of receptors. You will understand the role of receptors in pharmacology. Now one major function of receptors is that receptors determine the quantitative relations between dose and pharmacologic effect. Determines quantitative. Please note the word quantitative relation between dose and pharmacologic effect. Now what do we mean? If you are giving a drug, it is the receptor that determines the adequate dose for its effects. Now let's say, for example, if I'm going to give someone a drug, probably I'm going to give someone paracetamol, right? How do I determine if the person is going to take 1000 milligram, 100 milligram, 200 milligram, or 500 milligram? Remember, I will tell you, take 2 in the morning, 2 in the afternoon, 2 in the evening. How did the pharmacologist or the person that designed the drug know that the exact drug to be taken or the exact milligram is 200 milligram or 500 milligram? This is the role of the receptor. It is the receptor that determines the quantitative relations between dose or concentration of drug and pharmacologic effect. Now, in the sense that in the body there are numbers of receptors responsible for a particular thing. Now, these numbers of receptors requires an amount of drug, which we call dosage or concentration of drug, to bind to all the receptors to ensure that there is effectiveness. Okay, let me give you a layman explanation. If you have 100 receptors in the body that is causing headache, that is responsible for headache, I'm just giving you an illustration, and you are giving a milligram or a dose that is going to cover for 50 receptors. Remember, the work of the receptors here is to bind, the work of the drug here is to bind the receptors and work as an agonist, right? To reduce to inhibit the effect of the receptors and reducing the headache. Now, if the number of receptors or the milligram of drug that needs to bind to 100 receptors is 1000 and you are giving 500, what will happen is that the 500 that you have given might actually go and bind the 500 receptors or half of the receptors, leaving the rest, which means at the end of the day you are not going to achieve the required effect that you needed to achieve. So that is why they will tell you take the complete dose that you are given to take. Because before the drug was formulated, your pharmacist or the designers of the drug have understood that this is for this particular age, or for this particular dosage, or for this particular weight, this is the number or the amount of drugs that you need to bind the number of receptors that might be responsible for this in your body, causing this effect. Now, if you have taken overdose, more than you're supposed to take, you will realize that the effect of the drug will be too much in your body, because it has bounded all the receptors in the body that is responsible for what you are feeling, and there are leftovers, chemicals in the body, which has no receptors to bind and is going to cause you harm. So one major thing that receptors does is it determines the quantitative relations between dose and pharmacologic effects. Please take note of this. Now, the number two thing that the receptors does is that receptors determines the sensitivity of drugs. Now, let me write this. Determination of drug sensitivity. Now, what do I mean that receptors determines drug sensitivity, or the sensitivity of drug? Now, just like I told you guys, drugs are receptor sensitive, which is to say that you don't just give a drug and it goes to the body, it starts working anyhow. It starts looking for what is wrong in your body and start correcting it. That is not how it is. If it's how it is, that means you can give any drug for anything. Because once it comes to the body, it looks for what is wrong and it binds it. No. But what happens is that, okay, before now, let me give you a brief history about drugs and receptors. You will know more in our, just like I told you in our video that talks about drugs receptor mechanism. What happens is that before now, drugs are produced, and when the drugs are produced, they start testing it with probably animals or living things to match, and at the end of the day, they will be testing it to know the receptors that the drugs are going to match in your body. Because you know that receptors, drugs are receptor sensitive. But now what they do is that they take up a particular receptor and they use the receptor to produce the drugs that can bind it. Now, for a drug to bind the receptor, there are so many things that must be considered. It must be the same size of the receptor, it must be the same shape, and it must have the same chemical constituents or chemical makeup. But now let's proceed. So, which is to say that the receptor will determine the kind of receptor that the drug can bind to, will determine what the drug works for your body. Let's say, for example, you are feeling pain and you need to take a drug that can bind to a receptor that is causing pain. If you take a drug that can only bind to a receptor that is causing cough, you will take all the drugs, kill yourself with drugs, but at the end of the day, your pain is still there because you are taking the wrong drugs, which is binding to the wrong receptor. But by the time you are taking the drug that is going to bind to the receptor that is causing pain, you will discover that immediately you take it, your pain will be gone. So, which means is that receptors are very important in drug formulations, because without receptor, having an idea of the relationship between receptor and drugs, you don't know the right dose to give, and you're not going to know the right drugs to give because you don't know the right drugs that will bind to a particular receptor. Now, the third major function of a receptor is that it mediates the pharmacologic effect of agonist and antagonist. So what receptor does is that it mediates the pharmacologic effect of agonist and antagonist. Is responsible. You remember I told you that drugs act as agonists and antagonists. So the receptor is responsible for mediating the effect of both the agonist and the antagonist. Now, which means is that before a drug can work as an antagonist, there must be an increase in the number of receptors. So what it just comes in is that it inhibits the receptors and reducing the effect caused by the receptors. Before a drug can work as an agonist, there must be a reduction in the number of receptors in the body. So what it just comes in to do is that it stimulates the receptors, increasing the effects of the receptor working as an agonist. Now, we are going to look into two major aspects of pharmacology. We're going to look into two major aspects of pharmacology. There's a story I wanted to help us to understand this thing more, but if you are still having issues with receptor, I'll do a separate video that has to do with receptor drug mechanism. Now, aspect of pharmacology. Now, 1, 2. This is going to sound funny. Now, if you have been opportune to open a drug leaflet, there are so many things that they write on your drug leaflet. You see things like indications, you see things like dosage, you see things like adverse effects, you see things like a lot of things. But there are two things that you are going to see on the leaflet that is going to require more explanations that by the time you read it, most times you might not even understand what they are writing. You will see a word like pharmacodynamics, and you see another word like pharmacokinetic. These are the two major things that you need to understand if you must understand pharmacology. You just open your leaflet and you're reading through this and that and you see something like pharmacodynamics, pharmacokinetic, and you're like, what are these people saying? Now let me explain to you. Pharmacodynamics means the effect of drug in the body. That is the simple explanation. The study of the effect of drug in the body. While pharmacokinetics means the study of the effects of the body to the drug. Understanding these two things is going to help you to determine the best thing to use, or to determine the right drugs to use. Now, let me explain pharmacodynamics, which I said the study of the effects of drug on the body. The study of the effect of drug to the body or in the body. Now, this simply, in a simple layman's term, means what does the drug do to the body? And this thing has to do with the binding with the receptors and the host. Now, there are a lot of things that drug does to the body. But the primary thing, the first thing is the binding. But after binding, what else happens? It stimulates actions in the body, and ions are being passed from one place to another. You know, everything that happens in the body, your brain has to be aware of it. Just like if someone taps you, what does the tapping do to your body? You are meant to understand that your motor neurons are going to send signals to your brain that something is wrong. Then which the brain will send, so that something is wrong. That is when you are not going to feel the pain. Then the brain will in turn send neurons in your body to correct the effect of what is wrong. Now once you introduce a drug into your body, the drug carries out some processes in your body that will lead to an effect. Now, understanding this will determine the right drugs to use. Now, let me say, for example, there are some drugs that you take. Let's say someone that's an ulcer patient. There are some drugs that you take and it becomes so harsh to your system. Now, if you understand what this particular drug does to your body, you will know that an ulcer patient should not take this, because this drug contains probably an acid that will increase the acidic content in your body, leading to severity in your ulcer or leading to pain due to the production of high gastric acid in your body. Now, there are so many drugs that you take, and from there you'll see your side effects, and they'll tell you this thing may occur, it may cause dizziness, it may do this, it may do that, this thing should not be taken by a pregnant woman, this thing should not be taken by an infant, and this and that. These are so many things that you need to understand in pharmacology. That is what the drug does to the body. Understanding this will help you to know the right information about the drug and the best way to prescribe. Now, the next thing is pharmacokinetics. What does the body does to the drug? Now, this process is for you to understand what the body does to the drugs. There are some things that you need to understand, because this process entails your absorption, distribution, and metabolism, and lastly, elimination. You understand everything that the body does to the drugs if you understand everything here: absorption, distribution, metabolism, and elimination. Now, absorption means the process whereby the drug is absorbed from the site of administration to the central compartment. Then from there, how is the drug distributed? How is the drug absorbed? How is the drug distributed? How is the drug metabolized in the body? And how is the drug eliminated? Now, sometimes when you administer some drugs, let me say for example, when you take some antibiotics like your ampicillars, you discover that sometimes when you urinate, it's as if you are perceiving the odor of the drugs in your urine. This is just an example of what the body does to the drugs. It's not all the drugs that are going to perceive from your urine, because some drugs are eliminated through your urine, some drugs are eliminated through your sweat, and different ways. And also, understanding what the body does to the drugs. There are some drugs that are not easily absorbed in the body when given as a tablet. This will help you to know whether to design a drug as a tablet or to design a drug as an injection. Now, we're going to explain this better in our next video that will be talking about the routes of drug administration, the different ways of administration. Understanding what the body does to the drugs will actually help you to understand how the drug is being eliminated and how the drug is being metabolized. Let's say, for example, you want to administer a drug for like 5 days. How do you determine the exact dosage? And they will tell you, take this one in the morning, one in the afternoon, one in the evening. And some will tell you, take this one daily. And some will tell you this one, take this one 2 in the morning, 2 in the evening, do not take the afternoon. Now, this can only be possible because you have understood what the body does to the drug. This particular drug, body does different things to different particular drugs. That's why different drugs has different dosage. Different drugs are absorbed in different ways, distributed in different ways, metabolized in different ways, and eliminated in different ways. There are some drugs that when you take it in the body can sustain it for a very long time, so they allow you to take it only once in a day because it can spend in your body for 24 hours. But there are some drugs that when you take, it can only last for 4 hours. They tell you take this every 4 hours. So pharmacokinetics has to do with understanding what the body does to the drug. Now, there are some things that we actually need to look into before we end these introductory videos to pharmacology. Now, I think we are done with this, we are done with this, we are done with this. Now, remaining these three: absorption, bioavailability, and first pass effect. Now, let's say, just like I was asking you, you want to prescribe a drug for someone that's going to take care of headache. Now, the person needs like 1,000 milligrams of the drugs, right? Now, how are you sure that this exact milligram will be left in the body after absorption. Because one thing is sure, most of the drug that is administered, not at the end of the day, is not the exact milligram that you are going to get. Because different drugs has different half-life, which means different drugs will be eliminated at different time of your body. Now, understanding the aspects of absorption, bioavailability, and first pass effect is going to help you to manage this thing as a pharmacist, especially as a compounding pharmacist and as a dispensing pharmacist. Now let's look into absorption. I talked about absorption earlier. We said that absorption is the process or the transfer of the drug from the site of administration to the central compartment, which means your plasma, your body. Let's say, we can say the movement of drug from site of administration to central compartment. Now, this is part of what the body does to the drug. Different drugs are absorbed in different ways. Now, let's say, for example, there are some drugs that are formulated as tablets. There are some drugs that are only formulated as injections. There are some drugs that are formulated as tablets, injections, and everything. Now, these things are done understanding the absorption of the drugs. Now, there are some group of antibiotics called aminoglycoside. I don't know if you have heard of gentamicin. Gentamicin is a drug that you can only see in an ingestible form. You will never see the tablet. The reason is because this drug itself contains a hydroxy group, which makes it not absorbable or not properly absorbable through the GIT. Now, the only way to do this is to formulate the drug as an injection, because when a drug that is made as an injection does not need to go through digestion. It goes straight into the system and does its work. But now, do you always need to inject before you take medications? No. That is why drugs are formulated as tablets, different forms and different ways. But not just considering you, but they consider as well the content of the drug and how it is absorbed, which is under pharmacokinetics. Now, another thing is bioavailability. Just like we were saying, are you sure that if I administer 1000 milligrams of paracetamol, that at the end of the day, 1000 milligrams of paracetamol or 900 milligrams of paracetamol is going to be absorbed in the body to do the work which is supposed to be? This is understanding the concept of bioavailability. Bioavailability simply means the amount of drugs that is remaining or retained in the body after absorption. Amount of drug left in the body after absorption. This is actually what bioavailability is all about. How many is left? If I inject 1000 milligrams of paracetamol, how many will be left after absorption? Now, this is something that you must understand before choosing the dosage of drug. Because if paracetamol is not properly absorbed in the body, let's say for example, if taken through mouth, is not properly absorbed in the body, and you need to give somebody 1000 milligrams to carry out an effect that you need. Now, how about if you now give the person exactly 1000 milligram and at the end of the day only 500 milligram will be absorbed, it will look like you do not know what you are doing, because it's not going to carry out the healing effects. Now this is one of the reasons why you are advised not to take your medications with everything, every other thing like soft drinks and the rest of the things except water. Now some ways, there are some substances that can alter the absorption of a particular drug depending on the chemical content of what you are taking. So due to the fact that the pharmacist will not know the content of your drink and how it works with your absorption of your drug, so you are advised to take your medications with just water so that you do not alter the dosage. This is actually one thing you need to learn. So when they tell you just use water to take your drugs, it's not as if they are trying to punish you, but no, they are trying to make sure that the exact amount given is the exact amount that is being absorbed, and so many other things. So understanding bioavailability will actually help you. The bioavailability of a drug will help you to do the right prescription and the right compounding. Now let's talk about first pass effects. First pass effects. What do we mean by first pass effect? First pass effect is the amount of drug that is lost either due to elimination or metabolism as the drug passes through the liver or the lungs at the first place. Now let's explain. Amount of drug lost through elimination or metabolism as drug passes through, or you can say first passes through the liver or lungs. Now remember that your liver is actually responsible for filtering products, or for filtering drugs, or filtering anything that you take in, including food, drugs and anything. So immediately you take in your medications through your GIT, it goes through just like I told you, absorption, distribution, metabolism and elimination. As it passes through the liver phase, there are some amount of drugs that are going to be lost. Now, this actually is one of the understanding that you need to get in determining your route of administration. Now, just like I told you, let me give you an illustration. There are actually some drugs that actually suffer first pass effect naturally because of the content of the drug. I'm going to give you some example of the drugs. We have a propranolol, we have a bromocriptine, we have your lidocaine. But now let me ask you a question. Have you ever gotten into a hospital setting or a pharmacy shop, and probably you bring in or you escort someone to come and check his or her BP, and after checking it, the pharmacist discovered that the BP is high or the heartbeat is high, and the pharmacist gives your mother or the person you go with a particular tablet and asks the person to put it on their tongue instead of using water to swallow it. That is one example of trying to avoid first pass effects. Now, just like I told you that there are some drugs that suffer from first pass effects mostly, there's this drug propranolol that is used to control your blood pressure. Now, this drug, when swallowed directly, is going to suffer first pass effect as it passes through the body for absorption. But one way to reduce the first pass effect is to place it under the tongue, because when you place it under the tongue, it's going to melt and it's going to be absorbed there directly into the buccal cavity, passing through the superior venous cava. So in a way, you are reducing the first pass effect. That means if swallowed with water, you are giving probably 10 milligrams of the tablet. If swallowed with water, about 3 milligrams is going to be lost. You are going to be left with 7 milligrams. But if placed under your tongue, which is called sublingual, and what we are talking about, I will explain everything we are talking about route of administration. you might actually be able to preserve up to 2 milligram of the drug. Probably only one will be lost at the end of the day. So this is something that you need to understand about drugs and everything. Having an idea of all these things, absorption, bioavailability, first pass effect, will help you to know the right prescription and the right route of administration. Now, this is just an introductory video to pharmacology. In our next video, we'll be talking about route of administration, and the next video, we'll be talking about drug receptor mechanism. Doctor, I will advise you, stay tuned to this channel as we're going to get more content. Before I leave, I'm going to leave you with these words. Whatsoever you do in life, give your best to it, because only then will you be happy with your results. I'm Dr. Best, and I'm the happiest man alive. See you in our next video.